Hey, Seawolf community, Chancellor Sandine here with another segment of Ask a UAA Expert. Take a look.
My name is Chad Briggs. I'm the Director of Public Policy and Administration at UAA, and I'll be talking about policy responses to the pandemic outbreak. Why are some countries and regions hit harder than others by the outbreak? Is Alaska unique? We've seen that some countries are hit harder by the COVID-19 outbreak. Some of them, like Italy and Iran and China, have different histories or located different places geographically. The origin of the virus in the city of Wuhan and the region in China makes sense because that was the epicenter and it was difficult for the Chinese to get a hold of it in the first place. But other countries like why Iran, why Italy, why are they hit harder? In the military, we were able to model where these viruses were going to be spreading, and it depended large part upon travel patterns, air travel patterns, where tourists would go, where there would be religious pilgrimages. And some countries, some airlines were able to cut off some of those patterns early on. But what we found then is that if there was government mismanagement, if people didn't know exactly what was happening, if there wasn't good monitoring, and if there were demographic factors that put people in close proximity to one another. So for example, in Italy, you had multiple generations of people living in the same apartment. And that allowed the spread of the virus from the younger generations, who often didn't show any symptoms, to older generations, who were often more vulnerable. Alaska does have some of the same potential vulnerabilities. Alaska is an island in some ways, and it has islands within the state. But what that means is that once the virus comes here, and it is here now, then some communities are going to be more vulnerable than others. The rural villages in particular, they're far removed from a lot of the ICU units that we have in Alaska. They don't have very good medical care. You often have a number of people living in the same household. That's going to allow the virus to spread much more quickly and keep back any response from authorities. So what we need to do is to look at how do we keep the virus from spreading in the first place? How do we mitigate it? How do we not just wait for the virus to spread and then hope that we can hospitalize people, but actually keep it from spreading in the first place? How do we decide when it's safe to have events and travel again? It's really difficult for policymakers to make that sort of decision. Once we've decided that we need to mitigate the virus, that we need to have the social distancing, that we need to close down restaurants, public venues, schools, deciding when we come back from that isn't an easy decision, particularly when we have a disease that we've not seen before and which people don't have any immunity towards. So there are three basic policy approaches to handling the virus. The first is containment. Now, containment means that you know where the virus exists and you try to cut off any ability of the virus to leave that particular neighborhood or community. There were some efforts to do this early on, but the thing with the COVID-19 disease and the coronavirus is that it's very difficult to track. Unlike the SARS outbreak in 2002, which was a very similar virus, this virus doesn't really show many symptoms in people during the time when people can infect others. With SARS, it came more in the second week of infection, and it was far easier to see, oh, well, you're sick, so we have to contain you, and then you won't infect others. So in this case, containment is really difficult, and we just have to assume at this point that the virus is here. It's in the community. It's across the United States, and it's even here in Alaska now. And that leads to the next policy option, which is mitigation. Mitigation means that we start doing the social distancing. We institute policies that slow the spread of the virus. We can't stop it completely because this virus is here. There's no defense against it necessarily. And what they're trying to do with what you've heard in terms of flattening the curve means that you spread out the time that it takes for the virus to spread throughout the community. That means that it doesn't overwhelm the hospitals with people requiring hospitalization, ICU beds, ventilators. But it means then that we have to keep our distance, literally, from one another. Mitigation does have to stay in place for a long time. This is one of the most difficult policy decisions then, because it's difficult to sustain economically. How long can you keep theaters and restaurants and gyms closed before it strains the economic system in the community too long? How do you take care of people who have lost their jobs, who don't have any sort of income? Now, there is a third policy option, which is called suppression. And suppression means that you actually turn the curve of the pandemic around and it starts dropping significantly. Now, there was some news as of yesterday that the city of Wuhan in China was, for the first time, didn't report any new cases. The problem is that we can't always trust the public health statistics coming from the Chinese government. And without having really severe policies that can really ruin an economy, and without having vaccines, which won't come for another 12 to 18 months, then it's very difficult to have suppression. Because once you open up everything, once you allow people to congregate again, the virus can start spreading again. And it may not be visible for the first, say, 4 to 6 weeks, and then suddenly there's another outbreak. So what Anchorage has done, as an example, in instituting policies before we've even had significant cases here is really, really good decision. It's a difficult decision. It's difficult for many people, for many businesses, but it's necessary in order to stop the spread of the virus, or if not to spread, to keep it from spreading too quickly within the community and overwhelming the hospital resources that we have here in the state. What is the policy for a state or small country if there's an outbreak of COVID-19 cases like in Italy? The best thing that a state or a small country could do is, first of all, to start pre-provisioning medical supplies. The United States in general has been slow in doing this, but the state of Alaska, at least, was proactive in declaring a state of emergency before there were any community spread of COVID-19. What that means is that they need to provide resources for hospitals, not just in terms of ventilators and surgical masks, but also the ability to move into other areas. Where do you quarantine people, particularly if they don't have any suitable place to go? Where do you send people in a hospital if you want to separate out infected people from non-infected people? There's still going to be people who come in with broken legs, who come in with routine issues, and they still need to be treated. But they may need to be separated in case there are large numbers of potentially infected people coming to an emergency room. So that's one of the first things that any state needs to be doing. The next is national or federal intervention. That means looking to the larger government and saying, we need extra supplies. Not every state, not every community has all the resources that they need, and the role of the federal government is often to provide these, whether they need to build modular hospitals, as was done in China, whether they need to provide extra testing kits, whether they need to provide extra doctors and nurses. This is one of the roles that the US government, or in the case of Europe, larger governments might be able to provide. And there also needs to be close monitoring of vulnerable points. This really has to be emphasized. In other words, you don't simply monitor everyone. And that's not to say that people shouldn't have tests and testing available. But by monitoring, we mean look at those parts of the system that really need to be sustained throughout this entire outbreak. For the state of Alaska, that means really looking at the port system, the airports, making sure that people who work in grocery stores, whether it's restockers or the cashiers, those are really critical parts of our logistical supply chain right now. And in order to keep food coming, in order to make sure that we're not cut off from the rest of the world, then we need to monitor those systems very carefully and make sure that those people are considered essential workers. In fact, the state of Minnesota simply declared grocery store workers to be essential personnel. And that's a really novel move, but it's important to be able to do that and say that, yes, this is part of our supply chain. We need to keep food supplies coming in. We need to keep medical supplies coming in. We need to keep having daycare and food available for school-age children. And the last thing to mention is that countries or states or communities need to maintain transparency. In any public health emergency, the government has to be able to be trusted. And if there's any reason for people to disbelieve them, to think that they're hiding what's going on, to think that there may be disinformation running about, or that they're hiding cures, or that they're hiding the numbers of people who are sick, then this really cuts into the ability of the community to respond. It means that people won't act when the government tells them that they need to act. They won't make the necessary sacrifices necessarily. And it means that people will start taking their own actions. They'll start hoarding whether it's not just toilet paper, but essential materials that, keep in mind, many families don't have the ability to buy those weeks in advance. And particularly if they're being laid off, they're going to need to buy what they need day to day, week to week. And responding for everyone individually is simply going to be counterproductive to the community as a whole. What if the disease continues to spread and there's civic unrest? One of the really dangerous parts of this COVID-19 outbreak, not just in terms of the threats to the people who are infected, but to the larger political systems, is the role that divisions and disinformation are playing. There's a lot of bad information that's spreading out there about the nature of the virus, where it originated, potential cures that might exist for it, and this can be exploited by individuals or groups who look to really worsen the situation, to take advantage of things politically. And this isn't to point fingers and to say, oh, the media shouldn't be asking hard questions, or these people are holding people accountable too much, we should just let them go. No, we still need to be able to ask hard questions. But one of the difficulties is when there isn't trust in the government, when there isn't trust in the community, then the decisions that we make now during this disaster, during this outbreak, during this crisis, determines where our community goes afterwards. The government isn't going to be able to respond to everything. In many ways, this outbreak is larger than the ability of the government to solve things. Just cutting checks for everyone in the country, that's an important step, but it's not going to solve things. So in any community, whether they're recovering from a disaster, whether they're coming out of a conflict, the decisions, the small decisions that individuals make, really make a difference in terms of where that community is going to come out in the end. Do you band together or do you fall apart? Is the community going to be stronger coming out of this, or is it going to be dysfunctional? And that means making small decisions like when you're at the checkout, punching $3 that you're going to donate to the food pantry so that other people are going to be able to have food available. Reaching out to your neighbors and offering to help with homeschooling their kids. Offering their older neighbors to help them with their groceries if they don't want to go and potentially expose themselves to the virus. All of these are things that may seem small and may seem like they don't make much of a difference, but collectively they really do. Because it's the ability of the communities to band together, to look after one another. For our neighbors who may be out of their jobs, who may be struggling with certain things, if they come out of this knowing that other people were looking for them, looking after them, then the community is going to be much stronger coming out of this. Now, in some parts of the world, this is going to be very difficult. In countries like Kosovo or Bosnia, which don't have cargo ports on maritime borders, then they're going to be cut off. They're going to have politicians or insurgent groups that try to exploit this and to create a larger crisis. And in those cases, I can't say that those communities are going to come out of this much better. But if we have that opportunity, and here in Alaska we certainly do, then we don't simply approach this as individuals. We don't simply look out for ourselves or our families, but look at this in terms of how the community reacts and how we want the community to look once we emerge from this outbreak.